can freeze your fat away. This is
I love it.
I love this.
Yeah.
I'm all for this. I want to book my appointment before Dr. Van Dyke leaves. Van Dyke Laser and Skin. She is a familiar face to those of you who watch the show. CoolSculpting. We can sculpt our face. There's Sculptra now. Now we can sculpt the body.
The body. You know, liposuction has been such a huge thing for a long, long time. And people don't do liposuction because it hurts. It's very expensive. There's downtime. And there have been some really unfortunate incidents where people have been harmed, or, you know, there's like even a couple of deaths.
Oh, really?
Wow.
So we've been searching for something that's non-invasive that will reduce fat, and CoolSculpting is, and you started this, Tanya, by the way, because you called me in January and you said, I heard about this machine, I want to hear about it. So I researched it very thoroughly, came on and talked on the show in January, and I've gotten such a huge response to that that I thought I should come back and show you what it really looks like.
How does it actually work, Doctor?
Well, I'm going to show you. This is Sean, our patient.
Hi,
Thank
Sean.
you, Sean.
Hi, Sean.
Okay, now, much to his wife's chagrin, we're going to show his belly on television. So the first thing I do with the patient is I have him come in and I'll go, what bugs you? So he's gonna grab for me what bugs him. Then I have little hand pieces here. These are the shape of the hand pieces of the machine. So I figured this one is going to probably fit him like a glove, and it does.
I see what you're doing.
So I'll go ahead and I'll assess that. It's going to fit into our little treatment. Got a nice inch to pinch, and when he's done, he should have 25% less inch.
Immediately following the procedure, or do we have to wait?
No. What this procedure is going to do is going to reduce the fat cells by 25% by putting them into kind of a natural death. So they're not going to blow up. This is going to go on his tummy first, so cold.
And
cold.
what is that you're putting on there?
Cold?
This is a little gel pack.
Yes.
Is that cold?
Yes.
Very cold.
And this is what protects the skin from the cold. Because people go, well, aren't you going to freeze the skin? And the answer is, no, you don't freeze the skin. It protects it. It just lowers the fat to 33 degrees, which is a little bit under freezing. And fat freezes faster than skin does.
Because you could
I'm going to have you
damage
get comfortable.
the skin if you froze it.
That's correct. Don't try this at home.
Yeah, please don't use this at home.
So we've got our little gel pad on. And now what we're going to do is take this giganto suction cup. Okay. We're going to turn that on.
What does that do?
This is going to draw his fat into it. And these two plates in here are very, very cold. And that's going to chill him down.
Oh, if you do it on me, you'll need a bigger machine if it's going to draw the fat into it. There's not a machine to hold mine.
A little bit.
Now, Doctor, you're actually applying it to the abdomen section, but will this also, so this pulls in the love handles as well?
Yes, it does. So now he is, that's on there. That
Okay,
is
now do you
attached to him.
Okay, that's a good question, and that what Lou just said makes me think. Now we have it on his stomach, but would you put this then on his love handles if you wanted to target those specifically?
Smaller. Love handles. Back fat.
Okay.
Muffin top.
So it
Even
actually,
the inner thigh.
You actually apply that directly on where you're trying to reduce.
So that's the big hand piece. There are smaller ones. So what it's doing now, and I just turned on the cooling, and you can even see this is his countdown. It's going to be an hour. We're going to shorten it up a little just for the purpose of television. But this whole area is where he's going to be chilling down for that time. Okay. So it's lowering the temperature of the fat. 25% of those little fat cells are going to give up the ghost. When that comes off, it's going to be red and cold, and we'll show you later in the show. And then over the next 90 days to 120 days, one little fat cell at a time starts being reabsorbed by the body, kind of equivalent to eating 1 McDonald's French fry or 2 McDonald's French fries a day. So it's not putting a lot of fat in your system. People worry about that. Where's the fat go?
So it is a long, it's a fairly long process.
It's not only instant gratification, no.
Okay. But you do the process, and then how long will it be before we see results?
We're going to see, your results are going to peak at about 90 days, so we'll have to bring Sean back.
So,
is it hurting?
No, not at all.
Yeah, what is the sensation right now, Sean?
It feels like a tug and a little bit of a pinch.
Okay.
But as it's kind of going through, it's starting to get cold, and I don't really feel it anymore.
But it's certainly better than liposuction, isn't it?
Oh yeah.
Yeah, liposuction.
It's not. It's easy.
Painful. So now back to the question that people are a little concerned about flooding the body with fat.
Yes.
That's a good point. Like you said, it's going to go into the system, and the body will naturally flush it out.
Yep, but only very tiny amounts at a time. It's gradual over the those.
So the liver and the pancreas and all that.
No effect whatsoever.
Bombarded.
Again, it's like eating 2 French fries a day.
Yeah. So what is Sean going to be on a special diet? He just goes about his life.
You know, I tell my patients, do not gain weight.
Yeah.
Because if you gain weight, you're just going to lose the effect. So say we have this much fat we're pinching, and then in 90 days it's this much, but you gain 20 pounds, well, the fat cells that are still there are going to get fatter, and you won't see your results as well.
Now, looking at Sean, we were privileged to see how much fat you had, Sean. Not too much, I might say. That's not a whole lot of fat. Okay, so we saw that. That's a frame of reference for us. Would he need 1, 2, 3? Would 1 work? What?
Sean is probably going to need 2, maybe 3.
Because of the amount of fat?
Right.
Okay.
And I believe that you are actually on a fitness and diet regimen as well. So this is kind of helping him along with that.
So if you exercise and tone up naturally, that's going to aid this even more.
Oh, you'll get a better result. But we have a lot of patients, particularly young men, like 30-year-old men, extremely fit, and they just have this little thing right here. And what we also have a lot of, Tanya, is women in my age group and older, 50s and 60s and 70s, and they're not interested in the whole bikini thing, but they have this roll here.
Oh,
and they want their jeans to fit better, or they have this muffin top.
I sit behind this table?
That's not true. That's not true. So you would have to go 1 love handle at a time then?
Yes.
So you'd be lopsided for a
We do them in a row. This is so easy. I mean, look at him. You give him a book, he's fine. So we do it 1, and then we just go over. We usually do 3 to 4 a day on 1 person if we wanted to.
Oh, okay.
And then you get.
And then how long before he can do another one?
As soon as we take 1 off. Oh, on the same area?
Yes.
I would like to wait a month.
Okay.
Okay.
At a month, we don't have our full results, but we know, okay, I'm assessing that Sean's going to need to, let's just go ahead and do that second one in a month.
On the poster here, are these actual, well, I'm sure they are actual shots. These are actual shots of before and after shots of people who have had this procedure done, correct?
That is correct. And so the first 2 were just 1 procedure, and I think you can tell how that waist has come in on the one and the belly's come in on the other. It's just 1 procedure.
Wow.
And the bottom one is 2 procedures.
And how long will this last? Again, if he stays with a diet and stays with an exercise program, it's a lifelong.
It's like liposuction. If you kill those fat cells, they're not coming back.
Okay.
Unless you.
If you gain weight, you're going to make your other fat cells fatter,
and then
which will obliterate your results.
Square one.
Exactly. But he can go back to work this afternoon.
So actually, with the love handles, I mean, you're going to drop a couple of sizes, aren't you?
Well, you certainly can. I mean, of the people we've done where we've done belly and love handles, you know, they could, I'm not going to give you specific numbers, but they could definitely drop a size or 2. Yeah. And one girl I did who's in fabulous shape, she's a triathlete, she had a little belly thing, and she said she put her jeans on after 2 weeks and thought, oh, gee, I thought I'd wash these. You know, wash jeans feel tighter than loose jeans, and she had. So she called me up and said, I'm so excited, you know, I could definitely see this difference. So that was in a couple weeks.
Are we terribly expensive?
You know, it's about $600, $700 for 1 area, for a small area, so like a love handle. So compared to
6 and 6,
right,
you could spend $1,200 on your love handles.
You could.
But that's worth it.
Oh, yes.
Sean, how do you feel? I mean, this obviously your attitude will be much better. Your outlook on life will be much better, right?
Yeah, you know, I exercise, and my last thing to go is my belly. And if this can help it out a little quicker, it's worth the money to me, and it doesn't hurt.
We have to go. We're going to have Dr. Van Dyke over here with us talking about our open house. But very quickly, Sean, you're associated with the machine.
Yes, I am.
In what way?
I work for the company. I sell the machine.
Okay. Dr.
And
Van
his
Dyke,
wife loves that.
You're going to join us. You're going to join us.
The very cool Dr. Susan Van Dyke with us. This is again innovative. Every time you show up here, you bring something new that happens to make us look more wonderful than before.
Well, this technology came out of Harvard Medical School, and you don't get better scientific background than that.
Yeah.
One thing I forgot to mention just briefly is I have this beeper in my hand, and Sean is sitting over in the corner, and he has a little call button. So this does take an hour. You know, I don't sit with a patient for an hour. So I take the beeper with me. If he needs anything at all, a drink of water, want someone to scratch his head, whatever. My husband, well, I shouldn't say this on television. I did my husband, and he sat there and he ate chocolate. So he'd push the button and go, Susan, you got any more chocolate? Oh yeah, I'm in trouble when I go home now.
Good patient.
You are. He's just fattening up those other fat cells for you to take care of. We have one we can zero in here. We can zoom in on this one. This shows graphically cross-section of the skin and fat. Point out what people are seeing now.
Okay, what you're seeing in the first picture, which is this one, it's just an ultrasound picture of of skin and fat. So it's going down through the skin, and you can see that there's a fat where the arrows are showing the depth of the fat, and then after a treatment, how much shrinkage in the fat was achieved.
Because this area here is this area afterwards.
That's right.
That is amazing.
So the comparison, and when it comes to actual in living human beings, you know, it's a 25% reduction in fat layer pretty predictably.
Now, does it get any colder? As Sean is going through this, does it get a certain temperature then stay there? Does it continue to?
Stays at 33 degrees Fahrenheit.
Okay.
It's
Sean,
very,
you still
very
comfortable
comfortable.
over there? Okay, excellent.
As you promised, we're going to check in with Sean and, of course, Dr. Van Dyke and see how everything's going over there in the Cool Sculpture room.
How's it been?
Doctor, is our patient alive?
You breathing?
I'm breathing.
He even got some work done, so his boss will be very happy. All right, so we're going to just take it off for you now.
Okay. So now, will there be any sensation with taking it off?
We will see. I'm going to take his little toys away from him. A lot of people sit with their iPads and watch Netflix during this.
Okay.
So see, we've got a little pillow that gives him a little
Cushion.
desk there.
Yeah.
And now we're just going to turn that suction off. And I just put my little fingers under there and wiggle it on off.
Typically, this would have been an hour.
Typically, it would have been an hour.
Short an hour today, of course, but we hit it pretty close, I think.
We got about 45 minutes in, so this is just that gel pad that we had on earlier. So he's cold, and it's red. And is that hurting when I rub?
No.
Most of the guys, this is what they like best. The massage after.
Now, this is exactly the way it's supposed to look right now.
Exactly the way it's supposed to look. And what we've treated effectively is that whole ridge of fat there. Now, as you recall, it's not instant gratification as much as I'd like you to say that.
Yeah.
It is going to be taking the next 90, 120 days for that 25% pinching of an inch to reduce.
Sean's going to come back and show us the
Sean will
results.
come back.
Love to.
So you see the skin is just pink. That'll be gone in about 20 minutes. And it feels a little chilly, so usually we put a little warm towel on there.
And if Sean comes back to show us results, if you've had other surgeries, if you've had other procedures done, we will cite that and tell people what was done and how long and the whole process.
Absolutely.
Yeah. It's easy.
And again, doctor, they can see this and many other things coming up this Saturday,
Yes.
10 to noon.
And talk to me personally and ask me whatever questions they want to ask me.
Excellent. Dr. Van Dyke, thank you so much for being
Yes,
here.
and
Thank
Sean,
you.
thank you.
And thanks, Sean.
Oh,
you.
yeah. Well, Sean, you're just going to Sean, you're just going to be Mr. USA next time we see you.
Fantastic.
You know, if there isn't, is there a Mr. USA anymore?
I don't know. But there is a bodybuilding.
Yeah, the bodybuilding.
The bodybuilders.
That
but
fella.
yeah,
That fella you always saw in the magazines.
it used to be Arnold Schwarzenegger, as you'll remember. Not anymore, of course.
Thanks, doctor.
Yes, thank you.